Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbambu.com. So if you're in need of more support along your dementia care journey, I highly encourage you to check us out. So for today's video, we're going to be talking about the 4 cardinal symptoms of dementia with Lewy bodies. And then in the description box, there will be a link to a diagnostic symptom checklist by the Lewy Body Dementia Association, okay? So real quick, what is dementia with Lewy bodies? Well, it is a type of Lewy body dementia caused by Lewy bodies, which are clumps of abnormal protein deposits in the brain. Now, there are 2 different types of Lewy body dementia. We have dementia with Lewy bodies and we have Parkinson's disease dementia, okay? And we actually did podcast episodes on Parkinson's disease dementia as well as Lewy body dementia as a whole. So if you're interested in learning more, I will be sure to link it in the eye in the sky as well as in the description box, okay? So let's go ahead and get into the 4 cardinal symptoms of dementia with Lewy bodies, which you will often see abbreviated as DLB, okay? So the first cardinal symptom is fluctuating cognition, which refers to this significant variation in alertness and attention, often occurring from one moment to the next or one day to the next. And for caregivers, this can feel super confusing because one minute your partner seems fine, and then the next they're more confused and disoriented, or maybe they get super sleepy all of a sudden and you don't know why. And because these changes can be pretty unpredictable, it may leave you questioning whether or not your partner is faking it. And let me just tell you right now, they are not faking it, okay? It just comes with the territory of the diagnosis, okay? And it's also important to know that external factors like stress, fatigue, changes in the environment or the routine, or even some medications can exacerbate these fluctuations even more, okay? The second cardinal symptom is frequent recurrent visual hallucinations. And these hallucinations tend to be very vivid and well-formed and are usually of things like people, animals, or objects that aren't really there. And for some people living with dementia, these hallucinations can be very distressing, but not always. It really just depends. Now, the thing with these hallucinations is that they can appear pretty early on in the disease process and then persist throughout. But the good thing is that although these hallucinations can appear to be very real, some people will learn that what they're seeing is not real and learn how to adapt, or learn that if they close their eyes briefly, their hallucination will disappear. But unfortunately, that is not the case for everyone. It just appears way too real for them, and there's nothing that you can tell them to convince them otherwise. And it can lead to a lot of distress. It can lead to behaviors that put them in danger as well as anyone else that is around them, okay? Now, we will actually be hosting a webinar on the topic of hallucinations as well as delusions. So if you're interested in learning more about this topic as well as what you can do as a caregiver, then I highly encourage you to subscribe to our newsletter at letsbambu.com/newsletter so that you can be notified. Now, if you find this video after the webinar has passed, no worries, because all of our webinar replays live inside of the treehouse at letsbambu.com/treehouse, and all you need is a paw pass to access that content, okay? The next cardinal symptom is REM sleep behavior disorder, and with this disorder, people are able to act out their dreams. And the thing is, with these dreams, they're often vivid, action-filled, or violent in nature, okay? Now, why does this even happen? It's because the parts of the brain that are responsible for temporarily paralyzing the muscles during the REM sleep phase are not functioning properly, okay? And as you can imagine, without that temporary paralysis of the muscles while you're having an eventful, action-filled, or even frightening dream, it can really put the person who is dreaming at risk as well as whoever their bed partner is, okay? So as an example, there was a man having a dream about eating an apple, a vivid, innocent dream. but it resulted in him biting the ear of his spouse, which isn't good, right? Now, we actually have an entire blog post on the topic of REM sleep behavior disorder inside the Treehouse with a Paw Pass. But what I want you to know is that REM sleep behavior disorder doesn't always start out so dramatic, like with the hitting, kicking, or biting. It can actually start out a lot more subtle, okay, with just like twitching or jerking behaviors while they're sleeping. So that is an early sign to be aware of. And then the fourth and last cardinal symptom, which often appears a little bit later than the first three that we discussed, is Parkinsonism, which refers to Parkinson's-like symptoms, which are those motor symptoms that often overlap with Parkinson's disease, okay? So this can include a tremor, rigidity or stiffness, slowness in movement, a shuffling gait, changes in posture, usually a stooped posture, balance problems or repeated falls, and a masked face, which refers to an expressionless, rather blank appearance because they have a hard time using their facial muscles to display their emotions, okay? So it's important to know that all of these Parkinsonism symptoms may not appear all at once, as it tends to be pretty gradual in nature. So you may notice something like a resting tremor at first. So the person is sitting still, but you see that their muscles are kind of shaking, like their hand might be shaking or something like that. Maybe you notice that their head is kind of shaking, or maybe a slowness in movement. And then as their disease progresses, you may notice more symptoms, or the symptoms that they already had become more pronounced, okay? So just as a quick recap, the four cardinal symptoms are fluctuating cognition, visual hallucinations, REM sleep behavior disorder, and Parkinsonism, okay? So if you notice any of these symptoms in someone you know or even yourself, I highly encourage you to download that diagnostic symptom checklist that's in the description box, fill it out, and then schedule an appointment with the doctor to discuss, okay? But that is all for today's video. I hope that you found it helpful and informative. If you haven't already, please be sure to subscribe to our channel. And if you're in need of more dementia education and support, feel free to join us inside the Treehouse at letsbamboo.com/treehouse. Until next time, bye guys.